Hello everyone. In today's this lecture video, we are going to learn something about three important antimicrobial groups: quinolones, sulfonamides, and cotrimoxazole. In previous lecture video, you have learned about introduction of antimicrobial groups, right? In general introduction about all the common characteristics of antimicrobial drugs and in general aspects. With that introductory concepts, we are moving forward towards individual groups now. In each and every upcoming lectures of antimicrobial, you will learn something about each group of antimicrobial drugs, right? So in today's lecture video, we are going to learn about three these important groups: quinolones, sulfonamides, and cotrimoxazole. Amongst this, quinolones are very much important compared to sulfonamides and cotrimoxazole. So we'll start with the quinolones and then learn about sulfonamides and cotrimoxazole. Okay, so first we'll learn about quinolones. Actually, quinolones are now known as fluoroquinolones. Initially, nalidixic acid, right, which was the original quinolone, which is not used nowadays. Adding fluoromoiety to that quinolone group has given us the group that is known as fluoroquinolones. So whatever drugs we are using, they all are fluoroquinolones now, right? So recent derivatives are fluoroquinolones, not the quinolones. Now this fluoroquinolones, they are a group of drugs which are having broad antimicrobial activity, very popularly prescribed nowadays, right, for various types of infections like urinary tract infections, respiratory tract infections. So very much commonly prescribed after the cephalosporin, right? So we'll learn about it one by one. Now remember, as this is the first lecture video of antimicrobial, I am giving you just brief idea how you will come across various topics, right? In each antimicrobial group, you will first learn about some introduction about that group, then you will have uh, classification, right? So each group has some number of drugs, so you will learn about the classification. Then you will learn about the mechanism of that action of that particular group of drugs. Then you will have spectrum, then you will have uses and adverse effects. So this is the common, you can say, format in which each group will be described, not in the antimicrobial but in other groups also. Some variations will be there according to the system which you are learning, right? So first we'll start with the mechanism of action. So what is the mechanism of action of fluoroquinolone? In general, all the mechanism of actions you have learned in introduction, but now we'll go in the details, right? Right, by which mechanism of action fluoroquinolone is acting. Now, to know the mechanism of action of fluoroquinolones, I can give you one example. You all must have learned about DNA replication, right, in the biochemistry. So in that DNA replication, you need to revise it now because it involves DNA replication. So you must have come across this terminology, supercoiling, right? Supercoiling of DNA. So if we talk into the general phenomena, we can compare this DNA supercoiling phenomena with the ropes, right? જો તમે રોપને બે એંગલથી સેપરેટ કરી અને જો એને તમે ખેંચતા જાઓ, રાઈટ, તો પછી પાછળના ભાગમાં શું થશે, એક આંટી જેવું ચડતું જશે, રાઈટ? So that is known as supercoiling. Same kind of phenomena occurs in case of DNA, right? And that is the target site of action of this group, fluoroquinolones, right? To understand more this, we'll see one video which will give you more explanation about that, then we'll discuss about it. So we'll have one video over here. This video is from YouTube only.
In this animation, we demonstrate the biology of DNA replication, leading to bacterial cell division in a gram-positive bacterium, such as S. pneumoniae. The DNA is shown as a circular double strand within the bacterial cell. Like the DNA of all living organisms, it contains the unique genetic code for all of the proteins required for bacterial survival. Bacteria replicate by a process known as binary fission, whereby one bacterium separates into two new daughter cells. However, before this can occur, the bacterium must make an identical copy of its complete circular DNA. DNA replication requires that the two strands of DNA separate so that the genetic code of the bacterium can be read and a new complementary strand can be created for each of the original strands. To accomplish this, various enzymes, known as helicases, break the hydrogen bonds between the bases in the two DNA strands, unwind the strands from each other, and stabilize the exposed single strands, preventing them from joining back together. The points at which the two strands of DNA separate to allow replication of DNA are known as replication forks. The enzyme's DNA polymerase then moves along each strand of DNA behind each replication fork, synthesizing new DNA strands, in red, complementary to the original ones. As the replication forks move forward, positive superhelical twists in the DNA begin to accumulate ahead of them. In order for DNA replication to continue, these superhelical twists must be removed. The bacterial enzyme, DNA gyrase, which is also known as Topoisomerase II, is responsible for removing the positive superhelical twists so that DNA replications can proceed. DNA gyrase is an essential bacterial enzyme composed of 2A and 2B subunits, which are products of the GYRA and GYRB genes. This enzyme has other important functions which affect the initiation of DNA replication and transcription of many genes. With the combined involvement of these enzymes, an entire duplicate copy of the bacterial genome is produced as the two replication forks move in opposite directions around the circular DNA genome. Eventually, as the two replication forks meet, two new complete chromosomes have been made, each consisting of one old and one new strand of DNA. This is referred to as semi-conservative replication. In order to allow the two new interlinked chromosomes to come apart, another bacterial enzyme is needed, which is known as Topoisomerase IV. This enzyme is structurally related to DNA gyrase and is coded for by the PARC and PARE genes. Topoisomerase IV allows for the two new interlinked chromosomes to separate, so that they can be segregated into two new daughter bacterial cells. This animation will demonstrate two mechanisms of fluoroquinolone action. Fluoroquinolone antibiotics, shown here, are synthetic molecules that are bactericidal. The potency of these drugs is greatly improved by the addition of a fluorine molecule at position 6, and thus the term fluoroquinolones. Fluoroquinolones rapidly inhibit bacterial DNA synthesis, resulting in bacterial cell death. Although much is known about the molecular events that underlie the action of quinolone antibiotics, much remains to be clarified. Fluoroquinolones act by inhibiting the activity of both the DNA gyrase and the topoisomerase IV enzymes. For most gram-negative bacteria, DNA gyrase is the primary fluoroquinolone target. Fluoroquinolones have been shown to bind specifically to the complex of DNA gyrase and DNA rather than the DNA gyrase alone. As a result of this binding, quinolones appear to stabilize the enzyme DNA complexes, which in turn results in breaks in the DNA that are fatal to the bacterium. A second mechanism of fluoroquinolone action is shown here. With some exceptions, topoisomerase IV is the primary target of fluoroquinolone action in most gram-positive bacteria, such as Staphylococci and Streptococci, with DNA gyrase being a secondary target. The separation of two new interlinked daughter strands of circular DNA is disrupted. The final result on the bacteria, however, is the same. Bacterial replication is disrupted and the bacterium breaks apart. The relative potency of different fluoroquinolone antibiotics, and thus their spectrum of activity, is dependent in part on their affinity for either DNA gyrase or topoisomerase IV, or both.
So this was the video showing uh, mechanism of action of fluoroquinolones. So in general, you have to remember two topoisomerase enzyme, 2 and 4, right? Topoisomerase 2 and topoisomerase 4. In case of gram positive, it inhibits topoisomerase 4. In case of gram negative, it inhibits topoisomerase 2. Now its main activity is against gram negative organisms, so it mainly inhibits topoisomerase 2. Second thing you have to remember that it has very low affinity for mammalian DNA targets, and it requires very high concentration to inhibit mammalian this topoisomerase enzyme. So that's why it affects only bacterial cells and do not affect human cell, host cell, right? Once the person has taken medicine, fluoroquinolone, it will not affect DNA supercoiling of that host cell. It will affect DNA supercoiling of the bacterial cell only, which is inside that host, right? Okay, so with that mechanism of action, we'll move forward to the classification. Now, this is the classification of fluoroquinolones. It is set as generation wise, first generation, second, third and fourth generation. In each generation, it is according to the its innovation, right? First generation are older one, second generation is newer one to that, like that. So in first generation we have all this norfloxacin, ciprofloxacin, ofloxacin, pafloxacin and lomefloxacin. So in general, all these fluoroquinolones will have this suffix oxacin, so it will be easier for you to remember. Prefix you have to remember. These are the second generation, levofloxacin, third generation Getty, Spar and gamifloxacin, and fourth generation moxifloxacin, troafloxacin, aletrofloxacin, venafloxacin. Now, as this is your first system, let me tell you that classification, right? For each and every system, each and every group, classification is the thing that you will have to remember, right? There is no any concept behind that, no any you can say which I can explain, right? It is the only thing that totally depends upon your memory. You have to clear your own way to remember it, right? So these are the four generations of fluoroquinolones. Now coming to the next point, that is spectrum. Spectrum means what? That the range, right? What is the range of this group? It is active against which kind of organisms? That is known as its spectrum. Okay, again want to tell you something that spectrum will come in case of antimicrobials only, other system you will not have that. So in spectrum you have to integrate some knowledge of microbiology subject here. As far I know, bacteriology has not been started in microbiology, but once you will start learning bacteriology, various types of bacteria, then you will clearly understand it. At present I will give you only brief idea about this spectrum. Okay, now again in spectrum you can see this first generation is active against gram negative aerobes, gram negative cocci, Bacillus anthracis and Mycobacterium tuberculosis. So this is the spectrum of first generation groups, right? Now here if you will read books, they have given list of organisms. For example, gram negative aerobes, they have given list that E. coli, Klebsiella, Salmonella, like that, right? So what I suggest is that instead of remembering the each name of organisms, just remember the name of groups, right? Because ultimately in the microbiology you are going to learn about that individual organism. For example, this gram negative cocci માં કયા કયા આવે, so that you are going to remember in micro. For example, and gonorrhea and meningitis, right? So they are the gram negative cocci that you are going to remember in micro. You are going to learn it there. So once you learn it there, it will be easy. Don't mix up. Just remember that first generation is active against gram negative aerobes and gram negative cocci. Then you can recollect your knowledge of microbiology and apply and write down the organism rather than mugging up the organisms which are written in pharmac book, right? This is the one way by which you can easily remember spectrum. So that is a spectrum of first generation. Second generation has some addition. It is also active against gram positive cocci, right? The first generation was not active against gram positive. It is active against gram positive cocci plus mycoplasma, legionella, chlamydia. Again, I am telling that name of these organisms you will become more familiar with in microbiology subject. Third generation has enhanced activity for gram positive organisms, means compared to first and second it is more active again gram positive, plus tuberculosis, plus mycoplasma pneumoniae, plus mycobacterium avium. It is specifically more common in patients of AIDS. Fourth generation has active against anaerobes, remember, right? Here all the aerobes were there, here it is plus addition of anaerobes. So if you remember this, it will be easier to remember the uses of the drugs. I will show you later. Okay, so these are the classification and spectrum. Now coming to resistance, mechanism of resistance. Now you must have learned this during introductory lecture that organism develops resistance against that particular એન્ટીમાઇક્રોબિયલ ડ્રગ, એટલે એન્ટીબાયોટિકને અગેન્સ્ટમાં ઓર્ગેનિઝમ પોતે એવું કંઈક મિકેનિઝમ ડેવલપ કરે કે ડ્યુ ટુ વિચ they become resistant to that drug. Resistance means nothing. It is only thing that if you give antibiotic, then also it will not be able to kill that organism, right? That is means it is resistant, right? So there are specific mechanism in each organism, in each group of antibiotics by which they develop resistance. So in case of fluoroquinolones, it will achieve by mutation in gyrase and topoisomerase 4. So એના પોતાના જે gyrase and topoisomerase 4 enzyme છે, it will undergo mutation in such a way that fluoroquinolone will not be able to bind with that enzyme. So once એની સાથે bind જ નહીં કરી શકે, then how it will be able to act, right? And second is efflux mechanism. Efflux mechanism is that they will develop a porine channels, right, within the cells. જે porine channels develop થશે and they will throw out the fluoroquinolones, because to act fluoroquinolones requires some concentration. એક molecule અંદર જઈને કે topoisomerase ને inhibit ના કરી શકે. It requires some concentration together, right? So what will happen, as fluoroquinolone will try to enter inside, immediately it will throw it out, right? So it will not allow sufficient amount of concentration to get gather within the cell, which is required to kill the organism. That is the simple thing, right? So two mechanism of resistance, mutation and efflux mechanism. Okay, now coming, we'll learn about individual group. What are the characteristics of individual groups? Details are there in the textbook. I will highlight only the important points, right? So pharmacokinetically, in general pharmacology you have learned, right, distribution. In pharmacokinetics we have learned about distribution. That is the individual group of drugs has characteristic of getting concentrated in particular tissue. That is the distribution. So here this fluoroquinolone has characteristic of getting concentrated in GI tissue, respiratory tract and genitourinary tract, right? And it has short half-life. So depending upon this distribution, depending upon the spectrum, there will be the use. So as it is more concentrating in genitourinary tract, GI mucosa, respiratory tract, so obviously uses will be like that only. So they are useful in UTI, diarrhea, salmonella typhi infection, that is typhoid, then sexually transmitted diseases, soft tissue and wound infection. Another way to remember uses is remember spectrum, right? In microbiology you will learn that this gram negative aerobes, which are they and which diseases they are causing. For example, uh, E. coli, right? It is a gram negative aerobe, and E. coli is responsible for causing UTI. So UTI is the use of first generation, right? Then again you can correlate, right? For example, this anthracis, right? So Bacillus anthracis is responsible for causing anthrax. So anthrax is there in the use of, here you can see the last one, anthrax is there in the use of first generation. So this is how you can remember, right? You have to correlate with the spectrum as well as the uses. So spectrum jema hoy ema jena use hoy, so remember the spectrum and correlate it to the uses. So that's how you can easily remember the uses of that particular group, right? So in UTI, norfloxacin, ciprofloxacin, ofloxacin, pafloxacin, lomefloxacin all are used. In bacterial diarrhea, these all are drugs are used. Typhoid ma ciprofloxacin, pafloxacin used, right? These are the STD where they are used. Okay, RTI is nothing but respiratory tract infections. Again, એના સ્પેક્ટ્રમમાં માઇક્રોબેક્ટેરિયમ ટ્યુબરક્યુલોસિસ હતું. સો ટ્યુબરક્યુલોસિસની અંદર યુઝ થશે meningitis, prostatitis, surgical prophylaxis, neutropenia. Cystic fibrosis is a kind of lower respiratory tract infection, typically occurs in children, right? Genetical induced. And superficial ocular infection. Ocular infection ma this fluoroquinolone is the most commonly used group of drug, right? So remember the spectrum and uses you have to correlate, right? And once you will learn bacteriology in microbiology, it will be easier for you to correlate. At present you might have some difficulty in that, but once you learn that in the micro, correlate it with that, it will be easier for you. Okay, same way second generation pharmacokinetic parameters, oral and IV, both they have similar actions, means similar potency of action, and they have longer half lives. Benefit of having longer half life is we have to give it at the lower frequency. 3 વખતની બદલે 1 વખત આપો તો ચાલે, like that. Same way here uses. See, now coming to the spectrum, again spectrum of second generation. Here we are adding gram positive cocci, right? This is the gram positive cocci has been added, plus mycoplasma, legionella and chlamydia. So in indication, gram positive cocci, they are mostly streptococcus pneumoniae, right? So they are responsible for causing upper means respiratory tract infections. So in this second generation you will see they are most used in like infections like respiratory infections, acute exacerbation of bronchitis, community acquired pneumonia, sinusitis, right? So these are all the infections which are caused by gram positive cocci. That's why uses are like this. Again UTI is there. Okay, so that is second generation. Third generation, they are widely distributed, means you have seen in the first generation the distribution of first generation was limited to GI tract, genitourinary tract, respiratory tract, but in compared to that third generation it is widely distributed and having longer half lives. Uses, again pneumonia, sinusitis, bronchitis, UTI and TB. Now you will see the spectrum again. See, in spectrum, enhanced activity for gram positive, that's why respiratory tract infections are there, plus tuberculosis, plus pneumonia, plus avium. So tuberculosis ni andar for this third generation is widely used. Okay, so pneumonia, sinusitis, bronchitis, UTI and TB. Fourth generation, orally well absorbed and having long half life. Okay, now uses are almost similar to third generation, but here we have two newer group of drugs, right? They are electrofloxacin and this trevofloxacin and electrofloxacin. They have some individual characteristic that we are going to discuss, otherwise use are same. One more factor was there in the spectrum in case of fourth generation, that was it has enhanced activity against anaerobes. So in uses also anaerobes will be added, disease caused by anaerobes will be added to this infection. Now coming to some specific points about trevofloxacin and electrofloxacin, they active against gram positive, plus they have hepatotoxicity as a side effects, used for serious kind of infection. These all nosocomial pneumonia, right, hospital acquired pneumonia, complicated abdominal infections, skin and soft tissue, they are serious kind of infections. So in such infections they are used, right. Phenafloxacin is there, which is still under trial, and it is safer and with wide spectrum. So this was all about, we have learnt about the classification, then mechanism of action, then spectrum, and correlating spectrum with the uses, right. So this is the broad concept. In text other something like dose and that are given, that you will have to read it out and remember it. Okay, now important next thing is adverse reactions, right. We have learned pharmacovigilance in general pharmacology, so we are going to add, will have adverse drug effects of all individual drugs also. So in case of fluoroquinolones, NVD is nothing but nausea, vomiting, diarrhea. Remember, these are the most common side effects which most of the drugs have, but that doesn't mean you go on writing nausea, vomiting, diarrhea in each and every group, right. So use some logic and then write. Headache, dizziness, skin rash. Now this is more common, right. Fluoroquinolones are more common to cause skin rashes, so many patients can have this kind of reaction. Tendinitis and tendon rupture. Arthralgia, that is the joint pain. Okay, now there are some typical kind of side effects. Damage to muscle ligaments, ciprofloxacin is known to cause that. Photosensitivity, photosensitivity is nothing but once the patient, after taking medication, if patient goes out to sunlight, right, then exposure to sunlight will lead to some rashes and itching and that kind of reaction. So that is known as photosensitivity. Why that occurs? Because the metabolites of this drug which are inside the blood, when it is exposed to UV light, it will undergo some chemical changes in presence of UV light, and that will generate some chemicals which will cause that reaction. So that is known as photosensitivity or allergy to sunlight, but it is only in presence of that drug. Same person without that drug will not have that reaction in presence of sunlight. So that is photosensitivity. Lomefloxacin, PACE, PAR and gatifloxacin are responsible for it. QT prolongation. Now this is the side effect that you will get come to know if you take ECG of that person, right. So a patient is having some cardiac you can say symptoms, then you have to undergo this investigation and you will come to know that QT interval has been prolonged, right. So levo, gati and moxifloxacin are known to cause that. Hypo and hyperglycemia caused by gatifloxacin. So again remember, important in case of diabetics, right. Hepatotoxicity by travo and electro. Now this individual is important for MCQ purpose, right. So they are asked in MCQ, right, which of the following fluoroquinolone is known to cause QT prolongation. એમાંથી આમાંથી એક ઓપ્શન હોય ને બાકી બીજા ઓપ્શન હોય. So that's why I have given this individual list, also given in the text also. So remember that this particular drug is known to cause this kind of side effect. Interactions ની અંદર important with antacids. Why important with antacids? Because most of the time it is the you can say usual practice to give antacid with the antibiotics. એટલે antibiotic આપે તો સાથે antacid આપી હોય, right. So they have decreased the absorption of this group of drugs, increased concentration of theophylline and warfarin, that you will learn. And second thing, QT prolongation છે અહીંયા, right. So antiarrhythmic જે બધી drugs છે, they also have effect on QT prolongation. So antiarrhythmic drugs સાથે એનું interaction છે, that you have to remember. Pregnancy and lactation are contraindications. You don't give these drugs during pregnancy and lactation. And arrhythmia again, because it is causing QT prolongation. That's why with arrhythmia you can not give. Okay, that was all about fluoroquinolones. Remember, mechanism of action, classification, then you have to go the spectrum according to spectrum uses and ADR, right? Some typical ADRs you have to remember. Okay, now the rest of the two groups, sulfonamides and cotrimoxazole, they are very less commonly used drug nowadays. Fluoroquinolones બહુ commonly used થાય છે and sulfonamides એટલું બધું commonly used નથી થતું. Still used but not that common. So historically it is important because it was the very amongst one of the you can say antibiotics which are very used, you can say very initiate pioneer antibiotics you can say, right, કે જે antibiotics use કરવાની શરૂઆત જ આ ગ્રુપથી થઈ હતી, right. So it is historically important. Prontosil and that are historically important sulfonamides. Spectrum and resistant, right, so they are bacteriostatic. Now this terminology also you must have come across during your introduction session. Static means જે replication inhibit કરે but bacteria ને kill ન કરે, that is static. And bacteriolytic which kills the organism, right. Fluoroquinolones ને animationમાં આપણે જોયું કે છેલ્લે બેક્ટેરિયા આખું લાઇસિસ થઈ જાય. So fluoroquinolones are bacteriolytic, not the static, while sulfonamides they are bacteriostatic. they બેક્ટેરિયાને dormant સ્ટેજમાં લાવી દે પણ એને destroy ન કરી નાખે, right. So most of the organism માટે bacteriostatic છે and most are resistant now, right. So most of the organisms are resistant now. See, if you see the mechanism of action here, now folic acid is the one of the important nutrient that is required for organism to grow, right. So this is the pathway of folic acid formation, PABA plus pteridine, then dihydroteroic acid, again dihydroteroic acid, then tetrahydrofolic acid, which is the active form of folic acid. So here our drug sulfonamide, it inhibits this enzyme because it resembles this PABA, right. So by resembling PABA it inhibits this enzyme and this step will get blocked. So ultimately folic acid synthesis nahi થાય and bacterial growth will get stopped. Again it will not affect human cells, right. It will affect only this bacterial cells ની અંદર જે synthesis થાય છે that will get affected. And આ પછીનું જે group છે that it has here, the site of action is here, we'll see at that time. Now this is again the classification of sulfonamide. Here fluoroquinolone આપણે first, second, third generation એવી રીતે classify કર્યું. Here we are going to classify like short acting, intermediate, long and special purpose, means special antibiotics depending upon the duration of action. So these are the drugs, sulfadiazine, sulfomethoxazole, you have to remember this name. Adverse effects of sulfonamides. Remember the name sulfa, when you will come into the practice or when you will go into the round, especially in the dermatology department, right, allergic reaction કોઈ patient ને આવે દવાનું તો most common suspected group કયું આવે? Sulfa, right. It is a very much common group in which we can see the high number of patients having allergic reactions like light sensitivity, rashes, swelling of face, right. This kind of allergic reaction is more common in sulfa group, right. So it is all specifically known as sulfa allergy also. Okay, so that was in short about sulfonamides group. Uses will just broadly define like this sulfadiazine, sulfadoxine, sulfomethoxazole, right. They are commonly still used, right. For example sulfomethoxazole છે એ ટ્રાઇમિથોપ્રિમ સાથે કોમ્બિનેશનમાં યુઝ થાય છે, એ આપણે નેક્સ્ટ ગ્રુપમાં જોઈએ, right. Sulfadoxine is commonly used to treat malaria, right. Silver sulfadiazine that is used to treat burn infections, right. Sulfacetamide is used to treat ocular infections, right. Sulfasalazine, it is still used to treat rheumatoid arthritis and ulcerative colitis. Like that they still have individual uses, but apart from that to treat like in general UTI or respiratory tract infections, now they are not used for that. Okay, and last group is cotrimoxazole, right. Now this cotrimoxazole is nothing but the combination of two drug, that is trimethoprim and sulfomethoxazole. Sulfomethoxazole અહીંયા હતું, right here, with if you add trimethoprim. Now this is the example of FDA, fixed dose combination, that we have learnt in general pharmacology, right? બે ડ્રગને કમ્બાઇન કરો અને એક કોમન ડ્રગ બને, એક કોમન ટેબ્લેટની અંદર જ બે ડ્રગ ભેગી આવી જતી હોય, દેટ ઇઝ નોન એઝ FDA. એટલે તમે કોટ્રાઇમોક્ઝાઝોલની ટેબ્લેટ લો તો એની અંદર એક જ ટેબ્લેટની અંદર આ બંને ડ્રગ હોય, દેટ ઇઝ trimethoprim and sulfomethoxazole, and that is known as cotrimoxazole. Now FDA ની અંદર અત્યારે I am not going to going in the details, you must have learned in general pharmac, but they are used to combine because they are having common half life, right? બંનેની half life same છે, that's why you can combine it, plus there are certain factors which decides its FDA eligibility. Again, spectrum and resistance, they are almost same as that like of sulfonamide, right? But again, as you will see, you are here, you are going to combine with two drugs, the spectrum will get broader compared to individual drug. मतलब સલ્ફોમિથાક્ઝોઝોલનો ઇન્ડિવિજ્યુઅલ જે ઇફેક્ટ છે એના કરતાં કોટ્રાઇમોક્ઝાઝોલની ઇફેક્ટ વધારે હોય, રાઈટ? અધરવાઇઝ સાલ્મોનેલા ટાઇફાઈ, ક્લેપ્સેલા, એન્ટ્રોબેક્ટેરિયસી, એની સામે ઇટ ઇઝ active. Adverse effect, obviously it can lead to some amount, because some amount of folate synthesis will also get inhibited in human cell also, so it can lead to folate deficiency, contraindicated in pregnancy, and these are uremia and bone marrow toxicity. These are the two typical side effects which can result in this. Uses ni andar mostly they are used for to treat UTI or respiratory tract infection, especially both upper and lower both, diarrhea, dysentery, and pneumocystis zerovici is nothing but it is a typical type of opportunistic infection that occurs in case of AIDS, right? It is opportunistic infection, એટલે AIDS ના પેશન્ટની અંદર immunity down હોય, so this kind of rare infections can occur in that patient, so in that cotrimoxazole can be used. Again, cotrimoxazole is not the drug of choice for all this nowadays, because due to we have availability of some better options, so IKMA drug of choice nathi a, right? But can be used if other drugs fail. So with that we have completed three important groups: fluoroquinolones, cotrimoxazole and sulfonamides. Amongst this, fluoroquinolone is most important and sulfonamides and cotrimoxazole are somewhat lesser important. So hope you have learned something. Thank you.